This presentation is about model, theory, and personal philosophy applied in advanced nursing practice. Hi, let me start by introducing myself. My name is Eileen Sims. I've been a nurse for 17 years. I am originally from the Philippines. I am married to my wonderful husband, and I am a mom of three very active boys. So why family nurse practitioner? I chose F&P because I value family and I want to render expert care across the family's lifespan. My goal is to autonomously or collaboratively work with other healthcare professionals to provide a family-focused care. My culture is very family-oriented, and for me, to make a difference and share my expert knowledge that starts within the family level would be very fulfilling. As the family remain to be the building blocks of our society, health promotion, prevention of illness, and management of chronic conditions in this level is imperative. As a family nurse practitioner, my part will be educating and guiding patients on disease prevention and, more importantly, promoting a healthy lifestyle. The purpose of this presentation is to review my chosen theory, model, and formulate a personal nursing philosophy that will guide my practice as an advanced practice nurse. Let's talk about Nola Pender's health promotion model. According to Yochai and Kairos, Nola Pender's health promotion model is a combination of art and science of assisting individuals as they adapt to change and as they improve their lifestyle while progressing toward a state of optimum health. Nola Pender described the goal of nursing is to promote individuals' optimal health with a focus on encouraging healthcare decisions that will help achieve patients' goal. The health promotion model was rooted from Bandura's social learning theory, which is known for how individual behavior are affected by individuals' thought process. It was also influenced by Fishbein's theory of reasoned action, which presents how personal disposition and society affects one's behavior. This model emphasizes on health-promoting behaviors which can encourage by improving communication and by showing an individual the values and benefits of change. There are three major categories in Nola Pender's health promotion model. First, individual characteristics and experiences. This includes biological, psychological, and sociocultural factors that can be changed or unchanged and can affect individuals' view of health. Second, behavior-specific cognitions and affect. These are considered to have a motivational value. Nursing interventions target these factors because of its ability to change. It includes perceived benefits of action, perceived barriers to action, perceived self-efficacy, and activity-related affect. Interpersonal influences, such as families and peers, and situational influences, such as availability of choices and visual features of the environment, are various facets that affect behaviors in health promotion. Last is behavioral outcome. This begins when a person can personally commit to stay focused, to change into the plan of care. Behaviors that promote positive health outcome is the goal of health promotion model. The four major concepts of nursing meta paradigm was also discussed by Nola Pender. For her, person is the center interest of the model. These are individuals, families, and communities that are active participants in health promotion. Environment is the physical, interpersonal, and economic circumstances in which persons live. It can be manipulated by an individual to create a positive context. Environmental wellness can be achieved if harmony is present between human beings and their environment. Health. Health is the highest positive level of state. It is structured toward health promotion and disease prevention. It begins with individual self-realization of inherent and acquired human potential through goal-directed behavior, competent self-care, and fulfilling relationship with others. It continues when adjustments are made to maintain integrity and harmony within the environment. Last is nursing. Nurses' role is to raise awareness to encourage health-promoting behaviors. Collaboration with the individual, families, and community is necessary to achieve optimal level of health. Nola Pender is my model of choice because of following. This model has a familiar language that can easily be understood. The four concepts of nursing meta paradigm are well defined and interrelated. The model also defines the important role of nursing in meeting individuals' optimal well-being. And as the current healthcare costs continue to increase due to treatment of chronic illnesses, health promotion model focuses in promoting and providing incentives to encourage the community in striving better for health that leads to optimal outcome. Application to the nursing practice. Encourages the relationship between evidence-based practice and model. As an advanced practice nurse, this model will facilitate how theory can enhance my practice. As I utilize evidence-based practices to improve how I deliver care, this model will bridge the gap between the known theory and the present trend in healthcare. The model can be utilized by the nursing practice as a guide on how various facets in the past, present, and future affects individuals' behavior. It can also be used as a tool for behavioral counseling in promoting healthy lifestyle. Health promotion model continues to prove that the relationship and collaboration between an individual and the healthcare team members is still one of the core foundations of success in achieving optimal health. It reminds us, the practitioners, that health continuum begins with how individual perceive his health, and as experts, our role is to help maintain its balance. Let's talk about Dr. Madeline Lininger, culture care and universality theory. It is also called the transcultural nursing. It is defined as learned branch of nursing that are focused on studying and analyzing cultures in relevance to nursing to provide a meaningful delivery of care. It was developed by nurse anthropologist Dr. Madeline Lininger in the 60s while she was living and studying the Gadsab-Akuna people in the eastern highlands of New Guinea. She compared the distinct similarities and differences of this culture to that of her own. She describes the concept of nursing care and caring, which are ways of assisting individuals, group, in maintaining and regaining their health and well-being, and in dealing with disabilities and dying. The goal is to create a body of knowledge for the nursing science that promotes cultural congruent care, cultural safety and sensitivity. The theory values nursing care through assistance, support, and actions that are mostly parallel to fit the individual's, group, or institution's cultural values, beliefs, and lifestyle. This theory also values the collaborative relationship between the nurse and the community, through which the nurse incorporates the community's values and beliefs in the care process. So why this theory? Coming from an ethnical background, culture is a great value to me. Culture speaks the language of who we are and what we do. Lack of cultural awareness can be detrimental to nurses' care delivery. Improved health outcome can be achieved when nursing care is incorporated or congruent to patients' values and beliefs. As the nursing practice continues to expand and become universal, this theory is a great resource and can be utilized by nurses all over the world. And as our country continues to embrace different cultures from all over the world, it is important to recognize the implications of one's culture towards his overall health. The cultural care theory is a guide to become culturally aware as it facilitates holistic ways of providing our clients' needs. Let's talk about key concepts of cultural care theory. It utilizes culture to understand behavior. Culture is the learned, shared, transmitted values and lifeways of a group that molds, guides, and affects one's thinking, actions, and decisions. Another concept is incorporating care and caring in relationship to cultural competency. For Dr. Lininger, care is an essential component of curing. She presented that cultural care values are influenced by many factors, such as age, gender, sexual orientation, religion, social, political, socioeconomic status, spirituality, education, and so on. Further, she explained that individuals who receive a patient care that fails to be reasonably parallel to his beliefs will show signs of conflict, ethical and moral concerns, as well as non-compliance. Third concept is cultural congruent nursing care. It is considered as an interaction that formulates nursing as a discipline and a profession. It's a conscious effort of supporting and enabling decisions that fits one's cultural values and beliefs to allow a more meaningful and satisfying healthcare service. There are three modes of action for decision making to allow cultural harmony in practice. First, culture care preservation and/or maintenance. These are referred various professional acts that assist and support to help maintain one's culture. Second is cultural care accommodation and/or negotiation. It is referred as various accommodation and unique enabling actions provided by the caregiver that are culturally sensitive yet safe and effective for patients' health and well-being. Culture care repatterning and/or restructuring refer to those activities that involves mutual decision between the nurse and the patient that would help change, modify, or restructure their lifestyle to produce a better outcome. Past research studies. Ziegler and Lauderdale utilized Lininger's theory in designing a healthcare system through collaboration of the nurses and the community. In Kenya, where the ratio of patient and traditional healers is 1 is to 143 to 345, local indigenous knowledge is in providing community health service is greatly appreciated. This research study utilized Lininger's theory in designing a healthcare system through collaboration of the nurses and the community. The traditional healer's unique knowledge was incorporated to the nursing plan that led to a more meaningful and effective patient outcome. Culturally adaptive care takes place when the community can share their health belief system and cultural expression that can be included in the care delivered by the nurses. Sanchez-Eliminowski used Lininger's theoretical framework in her study about developing and implementing awareness workshop for nurse practitioners. Cultural awareness becomes a recognizable component of positive outcome among advanced healthcare providers. Cultural workshops to assess the needs for cultural competency is a successful tool for assessment. The findings from this study showed that the workshop have a positive and long-lasting effect for everyone and that it led to more effective learning. BAT utilized Lininger's framework in advancing cultural assessments in palliative care using web-based education. In the study, web-based education was supported to promote cultural competence that is applicable to nursing practice. Since cultural competency is an ongoing process, consistent need for reinforcement is needed to remain relevant. Application of theory to the nursing practice. Cultural care theory as applied in practice will help in bringing at close the widening disparity in quality health care among minority. In recognition of the barriers existing among diverse population, the theory offers a systematic approach in promoting culturally congruent care. Cultural care theory bridges the gap between the nurses and patients' culture. The concept of social hierarchy tends to reflect how healthcare workers impose their own beliefs and practices to other groups. Being aware of the cultural care theory gives a true meaning to the immense role of the nurse. Denninger's three action modes can be utilized as a framework in various practice settings along with the nursing process. For example, a 65-year-old male Filipino patient came into the clinic for a diabetic foot ulcer with poorly controlled diabetes. Culture preservation can be achieved when the nurse understands that the Filipino culture mostly eats rice with all their meals and that can be attributed to high blood glucose level, leading to delayed healing. Culture accommodation can be showed by educating patient on his dietary habits, especially portion control, and finding a healthier alternative such as brown rice. Cultural repatterning involves referral to the physical therapist and nutritionist to establish a plan of care that can help patient lower his blood glucose level. The theory also has increasing significance in accreditation standards, both in academia and practice. It encourages the nurses to become true experts on transcultural nursing and to achieve certification. My nursing philosophy. Advanced practice nursing is a scholar level of study that combines humanism and science in delivering a higher level of nursing care to all individuals, regardless of age, gender, culture, religion, and socioeconomic status. As future advanced practice nurse, I will show compassion and respect the sanctity of life by preserving, promoting, and maintaining one's dignity from the time of conception to the time of death. I aim to be continuously relevant and meaningful when providing nursing care practice as I strive for professional growth through lifelong learning. Graphical slide. What are you viewing right now is my visual presentation of the theories, models, and nursing philosophy. I utilized the 4 concepts of nursing meta paradigm in creating my own model. Person is still the center of the model with respect for dignity in life. Health maintained to be the highest level of state, and nurse and environment both supporting the concepts. I included 4 elements within lineager and health promotion model to develop my presentation. They are health promotion, prevention of illness, cultural congruency, and caring and compassion. Again, this is my visual presentation of how theories, model, and philosophy can be fit together. Conclusion. As the nurse profession continuously evolves to adapt to the demands of time, nurses must reflect and examine how their fundamental value system reflects within the meaning of the nursing profession. Nursing theories are the key concepts in the roadmap of nursing profession, and nursing model being the vehicle that helps lead the way towards success. Advanced practice nurses must continue to be embedded with his personal values and beliefs and allow its growth and flourishment. The success of nursing care is truly related to how practitioners delivered care to the best of their ability and knowledge and true compassion that embodies the dignity, love, and respect for human life.